Heavy periods, medically known as menorrhagia, are a common concern that affects many women during their reproductive years. While a typical menstrual cycle lasts between 3 to 7 days, and the average woman loses about 30 to 40 milliliters of blood per cycle, those experiencing menorrhagia may lose twice as much or more. This can significantly impact daily life, leading to discomfort, fatigue, and sometimes even serious health complications like anemia. Understanding the causes, methods for diagnosis, and available treatment options is essential for anyone experiencing this condition or supporting someone who is. To begin, it's important to recognize what constitutes a heavy period. Signs of menorrhagia may include soaking through one or more sanitary pads or tampons every hour for several consecutive hours, needing to use double sanitary protection, waking up during the night to change protection, bleeding for longer than a week, passing large blood clots, or experiencing symptoms of anemia such as tiredness or shortness of breath. If these symptoms sound familiar, it may be time to consult a healthcare provider. The causes of heavy periods are varied and can range from hormonal imbalances to underlying medical conditions. One of the most common causes is a disruption in the balance of the hormones estrogen and progesterone, which regulate the menstrual cycle. When this balance is off, the uterine lining can become excessively thick, leading to heavier bleeding when it sheds. This hormonal imbalance is especially common during adolescence and as women approach menopause. Uterine fibroids, which are non-cancerous growths in the uterus, are another frequent cause. Depending on their size and location, fibroids can increase menstrual blood loss or cause other symptoms such as pelvic pain. Polyps, small benign growths on the uterine lining, can also contribute to heavier periods, as can conditions like adenomyosis, in which the tissue that normally lines the uterus begins to grow into the muscular wall of the uterus. Other medical conditions may also play a role. Bleeding disorders, such as von Willebrand disease, can impair the blood's ability to clot properly, leading to heavier and more prolonged menstrual bleeding. Thyroid disorders, particularly hypothyroidism, can also affect menstrual regularity and volume. Additionally, complications related to pregnancy, such as miscarriage or ectopic pregnancy, can present as heavy bleeding. Certain medications may exacerbate heavy periods as well. These include anticoagulants, which are designed to thin the blood, as well as anti-inflammatory medications and hormonal treatments. Intrauterine devices, particularly non-hormonal copper IUDs, can sometimes cause heavier and longer periods as a side effect. Because the underlying causes of heavy periods are so diverse, an accurate diagnosis is crucial for effective treatment. When visiting a healthcare provider, be prepared to discuss your menstrual history in detail, how long your periods last, the volume of blood lost, and any other symptoms you experience. Keeping a menstrual diary can be helpful for tracking patterns and giving your doctor a clear picture of your cycle. The diagnostic process will often begin with a physical exam, including a pelvic examination. Your doctor may also order blood tests to check for anemia, thyroid function, and clotting disorders. Imaging studies such as ultrasound can help detect structural abnormalities like fibroids or polyps. In some cases, a procedure called hysteroscopy may be recommended. This involves inserting a thin, lighted instrument through the cervix into the uterus to allow for direct visualization of the uterine lining. Once the cause of heavy periods has been identified, treatment can be tailored to address the underlying issue, relieve symptoms, and improve quality of life. For some women, lifestyle changes and home remedies may be sufficient. Maintaining a healthy weight, engaging in regular physical activity, and managing stress can help regulate hormonal balance and reduce menstrual flow for some individuals. Medical treatments often focus on regulating the menstrual cycle or addressing specific causes of heavy bleeding. Non-steroidal anti-inflammatory drugs, such as ibuprofen, can help reduce blood flow and relieve menstrual cramps. Hormonal therapies, including combined oral contraceptives, progestin-only pills, or hormonal IUDs, can effectively reduce the thickness of the uterine lining and decrease menstrual blood loss. Tranexamic acid, a medication that helps promote blood clotting, may be prescribed during periods to further minimize bleeding. For women whose heavy periods are caused by fibroids or polyps, targeted procedures may be necessary. These can range from minimally invasive techniques, such as hysteroscopic removal of polyps, to more extensive surgeries like myomectomy, which involves removing fibroids while preserving the uterus. In rare cases where other treatments have failed and symptoms are severe, a hysterectomy, surgical removal of the uterus, may be considered. However, this is typically reserved as a last resort. It's also important to address complications that may arise from heavy periods, especially anemia. If you're experiencing symptoms like fatigue, weakness, or shortness of breath, your doctor may recommend iron supplements or dietary changes to help restore healthy blood levels. Emotional well-being is another critical aspect of managing heavy periods. The impact of menorrhagia on daily activities, relationships, and self-esteem can be significant. Seeking support from friends, family, or mental health professionals can be beneficial. Many women also find it helpful to connect with others who share similar experiences, whether through support groups or online communities. If you suspect you're experiencing heavy periods, don't ignore your symptoms or simply try to tough it out. Heavy menstrual bleeding is a medical condition with real physical and emotional consequences, and effective treatments are available. Early intervention can prevent complications and improve your quality of life. To summarize, heavy periods are a common but treatable condition. Causes range from hormonal imbalances and structural issues like fibroids to medical disorders and medication side effects. Diagnosis typically involves a detailed medical history, physical examination, laboratory tests, and sometimes imaging or specialized procedures. Treatments vary from lifestyle adjustments and medications to surgical interventions, tailored to the individual's needs and underlying causes. If you or someone you know is struggling with heavy menstrual bleeding, take the first step by reaching out to a healthcare provider. With the right support and treatment, it's possible to manage symptoms, prevent complications, and regain control over your health and well-being. Remember, you don't have to face this challenge alone. Help is available, and relief is within reach.